Well, welcome to the ADS-sponsored Healthcare Forum. Every month we have a forum that features somebody from our community, from outside, part of the ADS or non-part of the ADS, who is providing healthcare, has good experience in healthcare, and is able to teach us at a level where we can understand as lay people. Today, I have the pleasure and honor of introducing my friend and great colleague, Dr. Mehul Raval. He is a nephrologist at San Joaquin General Hospital, and I'd like to tell you about his credentials. He has been an attending physician in this area from 2017 and has worked in different hospitals, including St. Joseph's Medical Center, Lodi Memorial Hospital, Dameron Hospital, and San Joaquin General Hospital, and that's where he is working right now. He is an ex-chief of nephrology at Kaiser Permanente in Santa Rosa.
And international scientists, which took place earlier this year. The question, how did SARS-CoV-2
and he was also fellow of nephrology in Brookdale University Hospital and Medical Center in Brooklyn, New York. He did his residency in internal medicine at the same institution, and he is also a hypertension specialist by American Society of Hypertension. He is a certified nutrition specialist, board certified in nutrition. So he has, as you can see, a number of board certifications and very rich experience. His areas of interest are chronic kidney disease and nutrition in kidney disease. I think he will focus on this talk a little bit on nutrition in kidney disease because it pertains to us and acute kidney injury. We also have the honor of today of his parents, both Mr. and Mrs. Raval, who are online with us today. Uncle ji, Auntie ji, welcome to our forum. And we are truly honored to have you here in this forum. It's always a great pleasure and a matter of pride for a parent to see their son or daughter perform and give academic overtures. We all have enjoyed it, and I think today is your day. We all welcome you to our forum here in Stockton. This forum is a community service. It's not a medical advice, nor it is a consultation. Speakers address most common and most important subjects prevalent in our community. Please learn it from the educational point of view. Save your questions, write it on a piece of paper. Sometimes the answer will be in the next slide. But if at the end you want to have comments, you want to ask any questions, please feel free and be prepared. I would request the audience that start the question answer session. Don't hesitate until we are closing the meeting, because when I'm closing the meeting, I have formally closed the meeting, people start asking questions, that becomes a little difficult. So please take a note of that. So without any further ado, I will ask Dr. Mehul Raval to kindly deliver his presentation. Thank you. Mehul, you can unmute yourself.
Yeah. Good evening, everyone. It's a nice Sunday evening with good weather outside. Finally, thank you for staying indoors for this presentation. So I'll just go over the basics, and I would rather you ask questions as they come, but I agree with Dr. Srivastava to hold the questions till the end of the talk so that we can answer them. I should be able to answer every question. You just have to be patient, and no question is silly or stupid. Every question is is important, because if you get your concept clear, that means I will have less work to see patients with kidney disease if they are able to control their disease process by simple interventions For example, like avoiding the wrong medicines, drinking enough fluid, and controlling their chronic conditions. So a brief anatomy of a small one slide on the anatomy of the kidney. As you can see, the left kidney is slightly higher than the right. Uh, the kidneys are about the size of your fist. They are in the back, right behind your rib cage, at the place where your rib cage meets the spine in your back, and they're very rich in blood supply. So 20% of each heartbeat, the blood is supplied to the kidney. So if if your heart is pumping out 5 liters of fluid, 1 liter passes through the kidney. So it's about 500 cc on either side. Okay. The kidneys are very active organs, very active. So they filter about 150 to 160 liters of blood every day, but only 2 liters of urine is produced. So the remaining 158 liters is reabsorbed back into the body. So, as the numbers show, the kidneys are very energy requiring organs. They are very rich with blood supply, and that is why any injury to the kidney can cause severe bleeding and potentially death, just because the blood supply to the kidneys is very rich. Now, this is a fact to be remembered when we do something called the kidney biopsy, where we put a needle in the kidney to take a sample to see if there is any disease process going on. So anytime you put a needle into the kidney, because the blood supply is so rich, the potential complication is one of bleeding. So as I just said, these are two bean-shaped organs, each about the size of a fist, just below your rib cage, one on either side of the spine in the back. So they filter about 150 liters to produce 2 liters of urine a day. So this is a simple slide which shows the different functions of the kidney. This is a good cartoon, but this describes it better. So the easy way to remember would be the mnemonic called a wet bed. So A stands for maintaining the acid-base balance. So every food group we eat eventually results in generation of an acid load for the kidney. Now, vegetarian diet gives you a less acid load. A non-vegetarian diet gives you a higher acid load. So one of the main functions of the kidney is to maintain the acid and base equilibrium in our body. How does it do it? By changing the acidity or the alkalinity of our urine. That is number one. Number two, it maintains a water balance in a way that sometimes you can even get by drinking 10 liters of water a day. Your kidney should be able to eliminate all of it. So in some cases, you can drink 20 glasses of juice a day if your kidneys are normal. People suddenly say, I'm going to start juicing. Now you juice two glasses a day is okay, but some people go extreme and juice 15, 20 glasses of juice a day. Now that gives a lot of sugar load, a lot of potassium load, and the kidneys, if they're functioning normally, will be able to take care of all that extra electrolyte load it has on itself, which brings us to the next point, the electrolyte balance. So electrolytes, as a concept, we just have to remember that they are electrically charged particles. Okay. So when we talk about sodium, now sodium always comes with a positive charge next to it. What does that mean? That means, if you remember our school days, there are two electrodes. One is positive and one is negative. What we learned as the anode and the cathode, right? So charges which are positive, like sodium, will basically go towards the cathode, which is negatively charged. So electrolytes are electrically charged particles which are a big part of our diet. For example, sodium, potassium, calcium, magnesium, all of these electrolytes, their narrow level in the blood is maintained by the action of the kidney. The next part is the toxin removal. Now, all the food we eat, especially protein, is converted into something called urea. So urea is generated by the metabolism and the digestion of protein. There is another substance called creatinine. The creatinine comes from our muscles. Muscles have a turnover. So when muscles are broken down, they produce something called creatinine. Now, the urea and the creatinine, if they're not removed from our bodies, can cause a lot of problems. They can cause you to have altered taste. They can cause you to have altered memory. They can, because they're electrically charged, they can also cause you to have swelling of your brain and seizures. And that is why when your kidneys are not working well, we need a machine called the dialysis machine to do the job of your kidney. So these are the toxins. And also to be remembered, even salt, sodium, is also a toxin if it is consumed in excess. So the kidney removes extra sodium from your blood by filtering and reabsorbing. It's a very active mechanism where blood is filtered through the kidneys reabsorb and keep how much the body needs, and the rest of it is eliminated. Blood pressure control. Now if you just have coming back to the sodium, it's so important that we talk about salt intake and sodium in the setting of kidney disease, because blood pressure is the number 2 reason for kidney failure in the world. So anytime your blood pressure is more than 140/90, have no doubt it is causing some damage to many organs in your body, including the heart, including the brain, including the kidneys. So if your blood pressure is 160/95, one reading, that should be okay. But if it is sustained more than 140/90, there is guaranteed damage occurring, no doubt about it. Now the last two are surprising because you would think, what does kidney have to do with your hemoglobin? Now the kidneys produce a hormone called erythropoietin, which is the basic building block for your bone marrow to produce red blood cells. If your kidneys are working 50%, then only 50% of the hormone required by your body is produced. If your kidneys are working 10%, then only 10% of the erythropoietin required by your body is produced. So you can imagine, it's only if your kidneys are working 100% would you have your blood counts to be normal. Now, a brief history on erythropoietin. Before it was synthesized in the lab, people didn't know that the lack of this hormone causes anemia. So when we had patients with kidney disease, hundreds and thousands of them walking around, and their hemoglobins were so low they needed blood transfusion once a week because they didn't have erythropoietin. People have tried steroids. People have tried growth hormone. They have tried extreme treatments because these patients needed blood transfusions on an average once a week. Now multiply that by the hundreds and thousands of people with kidney disease, how much blood would be required to maintain their hemoglobin? So production of erythropoietin by the kidney is a very important important step in the management of anemia. And finally, vitamin D metabolism. The last step in the production of active vitamin D happens in the kidney. So if you think that sunlight is required for vitamin D production and you stand in the sun for 3 hours and you eat all the right food which has enough calcium and vitamin D, but if the kidney function is low, then the final step in vitamin D metabolism is going to be stopped and you're going to be vitamin D deficient. So now, with that background, let's talk about what are the different ways in which the kidney can get damaged. One is acute and one is chronic. Now, when we talk about acute, it is what damage happens when it happens in a matter of minutes to hours to days. So Dr. Srivastava and myself, him being in the ICU, our main interaction is for acute kidney injury. That is what happens in a matter of minutes to hours to days. Chronic kidney disease, on the other hand, it occurs over a period of months to years. Okay? Now, there can be somebody who already has a chronic kidney disease. Now he falls sick with pneumonia or COVID or dehydration, many causes. They can have the acute component superimposed on the chronic kidney disease. Okay? And this happens quite frequently. Now, the burden of disease is that currently there are 37 million American adults who have chronic kidney disease and millions of others are at risk. Now, the second part of the statement, millions at risk, it comes to about 33%. So if you're standing at a traffic light and you say, everybody with chronic kidney disease, blow your horn, 1 in 3 cars, you're going to hear a honk. Now, at the same traffic light, if you say loudly, honk if you're obese, 1 in 3 of them are going to honk. So as you can see, the disease incidence is so high that 33% of people are obese, at least 33% have chronic kidney disease, and the situation is only going to get worse. Okay? Now the problem with chronic kidney disease is it's called a silent killer. That means there is no overt symptom until the kidneys are damaged. For example, if you have asthma, your symptoms will be obvious. You're going to have wheezing, you're going to have shortness of breath, and then you get tested and oh, he has asthma. If you have pneumonia, you have fever, shortness of breath. Now with kidney disease, it's a silent killer. You don't notice the symptoms until very late in the disease process. So this gives you a global map as to how much chronic kidney disease is prevalent. As you can see, this is for 100,000 population, what we would call 1 lakh in India, for 1 lakh. So US is about 200 to 300 people per 1 lakh population. Now see the other countries. For example, see our neighbors down here in Mexico. They are almost got 4 to 5 times more chronic kidney disease than us. Now go to the Asian subcontinent. It's almost 2.5 times the amount of what is here. Now, China, maybe the data is not complete. So we would say, you can say US and China, the biggest populated places. Look at the whole of Africa. The whole of Africa is the same as India. Now, if you see the main population in China, India, Africa, you're going to see that that there's a lot of chronic kidney disease prevalence in the world. So that brings us to the causes. The number 1 cause for kidney disease globally, undoubtedly, is diabetes. So if you're diabetic, the only way you can be counted as a non-diabetic is if your sugars are well controlled, if your hemoglobin A1C is consistently less than 7%. If not, then you are a diabetic, and if you're diabetic, you're the number 1 reason for the kidneys to fail in the world. Number two is high blood pressure. So between the two of these, we almost cover more than 70% of kidney failure in the world between just these two diseases. The remaining 25 to 30% is all these causes. So you can imagine that if these two conditions are diagnosed and treated early, then people would live longer, people would live happier, and the healthcare costs would be drastically reduced. Okay? The third cause, glomerulonephritis is just a fancy name for an inflammation of the kidneys. It's like how you get a rash on your hand, a reddish rash which is itchy. The same kind of rash happens in your kidney. The only thing is you can't see it. So glomerulonephritis is nothing but inflammation of the kidney. Multiple cysts in the kidneys, which is a pure genetic disease. Now, while we are at the cyst, it would be good to know that everybody above the age of 50 will develop one or two cysts in each kidney. That is normal. So for any reason, if you have an ultrasound or a CT scan done and it shows that you have one cyst, there is nothing to worry. It is just a part of your aging process, like how you would have wrinkling of your skin or graying of your hair. The kidneys can develop some cysts. Okay? In urinary tract infection should be diagnosed and treated right away. Now, very important is a drug that is toxic to the kidneys, which we'll talk about a little later. And then you have all these other diseases which are very rare, and among the top 5, you cover more than 95% of kidney disease in the world. So diabetes, high blood pressure, inflammation of the kidneys, cysts in the kidneys, drug, and infection. So you say, okay, so now that you're a kidney specialist and you're talking to me about kidney disease, what are my risk factors? So the same as the causes. Number one risk factor, diabetes. Either you have it or you have a family history. Even if you have a family history and you don't yet have it, it's still a risk factor. High blood pressure, heart disease. If anybody in your family has already had these above 3, it's a disease. And not to forget, obesity. So what are the other risk factors? Age 60 or older. So after the age of 60, our kidney function drops by about 1 to 2% every year. So from 60 to 80, 20 years, your kidney function may drop about 20 to 30%. That happens because it's age related and your kidney cells are old, and that's why it happens. Some studies show that if you have a low birth weight, the reason for this causing kidney damage is because you have less cells in your kidneys. So if you have a low birth weight, you're at risk of kidney disease. Now, if you use a lot of painkillers like ibuprofen and naproxen, so we'll talk about this a little later. Lupus is the same as the inflammation of the kidney. If you have urinary tract infections, I get a urinary tract infection every 2 months, you're at risk for getting chronic kidney disease and kidney stones. So I'm sorry, it's very boring because after listening to me, you're going to say that at the end of this talk, you did not give me any exotic, any special advice on how to avoid getting kidney failure. But there are just these simple things you need to do. You get regular checkups, you control your blood pressure, 140 over 90, manage your blood sugar, hemoglobin A1C less than 7%, eat a healthy diet. We'll talk about the diet, get some exercise. So if you're going to take the mail every day, is not exercise. If you take the dog for a walk, is not exercise. Exercise is you need to have a sustained heart rate increase for 30 minutes for at least 5 days a week. That is exercise. Okay. Obviously, you quit smoking. Do not overuse pain medicines. Again, we'll talk about these medicines. So these are the ways in which you can diagnose and control the chronic kidney disease. Now, the other way what things can happen is if you have kidney disease, what can happen to you? So you can have heart disease, you can have your cholesterol management is complicated because kidney disease can make you have higher LDL cholesterol and higher chance for heart attack. So you have a higher chance for heart attack and stroke because your kidneys control the blood pressure. Now they're not working. Your blood pressure goes out of control. It puts your life at risk. It makes you weak bones because remember the vitamin D part of the kidney function makes you have weak bones. You can have nerve damage. Eventually, you'll go to kidney failure, end-stage kidney disease, or end-stage renal disease. And because it produces a hormone for anemia, you can have anemia or low red blood cell count. So what are the symptoms? Now, by the time you reach these symptoms, you should have already seen your doctor. So if you are at home and you're having these symptoms, maybe it's a little too late. So you can have unexplained fatigue or weakness. You can have difficult or painful urination. Now, foamy urine is because of the protein leakage. You may need to flush 2 or 3 times to get rid of all the bubbles. That is foamy urine. If you have any blood in your urine, you have to get it examined. Any blood in your urine is abnormal. You have thirst, you have puffy eyes, you have swollen face, hands, abdomen. These are very non-specific symptoms, but these are the ones which are more specific for kidney disease. So it comes back to that. You have your annual checkup. Now in the annual checkup, everybody has a blood pressure test done. 140 over 90, it has to be there. The next thing what we do is we do a test for protein in the urine. So any amount of protein in the urine other than a minimal amount is considered abnormal. Okay, and then we do what is called the glomerular filtration rate. Basically, just an exotic term to kind of find out how well your kidneys are filtering your blood. Okay. So the good part about this is the equation they use currently, it's basically for the primary care doctors to recognize that your glomerular filtration rate is low and refer you early to a kidney specialist. Now, studies have shown that patients referred to a kidney specialist early, they live longer and they go on dialysis later than patients who are referred late. So from the primary care doctor's perspective, as soon as they come to know that your filtration rate is low, they may ask you to see the kidney doctor. Do not feel alarmed or do not feel scared. It's just so that you can establish with us sooner and we can take care of you sooner rather than later. So what are the things you can do? It comes back to the same boring part of medicine. Control your blood pressure, control your sugar, reduce your salt intake. We're going to talk about the medicine. Now this moderate protein consumption is for people with established chronic kidney disease. If you don't have it, you don't have to do it. You get an annual flu shot and COVID-19 vaccine. So 9 things what everyone should do, not only with kidney disease, same: exercise, control weight, diet, quit smoking, drink in moderation, stay hydrated, cholesterol, physical, family history. This is the boring part which you do any internet search or you go to any family doctor, they'll tell you to do this, but at the end of the day, this counts more than even medications, drugs, and other interventions. This has more benefit. So now we come to our 2 very close friends, which are frequently seen in our medicine cabinets, Aleve and Advil. So when you go to Costco, you get ibuprofen, 600 tablets for only $9. You're like, let's buy it because everybody in the house needs to take, you have a back pain, you take this, you have a toothache, you have a headache, you take this. The only The only problem with these medicines is that they're dangerous to the kidney. They can cause acute kidney failure, and in patients who have some chronic kidney disease, this can make it worse. So what do we do? I have a toothache. You're telling me not to take this medicine, but how should I do it? So what you do is you take the minimum dose for a short time. You're not going to have a toothache forever, right? So if you take ibuprofen 400 milligrams and your pain is controlled, you don't need to take 800. So you take 400, you take it twice a day, drink enough water to keep yourself well hydrated. You're going to have no problem. Now, if you have a knee pain and you're taking 800 milligrams of ibuprofen 3 times a day and not drinking enough water, in 3 days, your kidneys are going to get damaged. Okay? So very important. These drugs are very well known to cause kidney damage. So this is an excellent study which shows that how can a diet affect kidney disease. Okay, so they collected a lot of data from 18 studies. They studied 630,000 adults were part of the study who were followed for 10 years. So it's a very good study. Okay, so they check for chronic kidney disease and they check for how much your kidney function can fall. So in this, they encourage higher intake of fruits and vegetables, okay, legumes, healthy nuts, whole grains, fish, and low-fat dairy. That is, fat-free yogurt, fat-free, low-fat cheese, those kind of things. They encourage people to eat less of red meat, processed meat, salt, and sugar-sweetened beverages, which is basically sodas and fruit juices. So they found that if you eat this healthy diet, you're going to get less chance of getting chronic kidney disease, and you're going to have lower chance of protein leakage from your kidneys. So long term, it's going to be effective for your kidneys. Your kidneys are going to leak less protein, but it was not associated with decrease in your filtration rate. So 2 out of the 3 parameters were beneficial, which is good. So keeping it simple, this is how your plate should look. Straightforward, comes from the U.S. Department of Agriculture. So this is how your daily plate should look. It should have about this many fruits, not processed, not fruit juices, just fruits washed and cut up. This many vegetables, this many grains. This should be the protein, and dairy is recommended to be low fat or fat free. So there are only five food categories which you need to know. And if you follow this, then this is going to happen. You're going to have less chronic kidney disease, less protein leakage, and you live longer. So now, very common question, what everybody asks and wants to know is fluid intake. What fluid should I drink? How much? And in the end, explain to me why you're saying this. So to keep your kidneys healthy, you have to drink water. So now the common misconception is everybody tells drink 8 glasses of water. 8 glasses, each glass is 8 ounces. So 8 times 8 is 64 ounces. That should be enough. But I don't think one size fits all. So you have to consider your age, the climate, how much exercise you're doing, if you're breastfeeding, pregnant, or if you have any illness which is making you lose more water. So, 60 to 70% of our body weight is made up of water. So what does water do? It makes sure that our blood flows through all our vital organs and provides them with nutrition and oxygen. So if you don't drink, obviously you'll get dehydrated. So if you get mild dehydration, you'll feel tired, and if it's severe, then you're going to have muscle cramps, and you're going to cases where even you pass out. But so this is the recommendation on Institute of Medicine that men, they need about 3 liters of fluid every day, and women need about 2.2 liters. Now, this 13 cups need not mean only water. There is fluid even in your other beverages like tea, coffee. There's going to be fluid in your food. If you're eating dal, you're going to eat rice. All of that has fluid in it, so all that to be counted. So all said and done, I would say about 2.5 liters for men of water intake, and about 1.5 to 2 liters in women is what is required, unless you have special circumstances. If you're doing a marathon every week, then obviously you'll need more. If you're sitting in a sauna and sweating more, if you have infection, you have fever, so you lose about half a liter of fluid in your sweat and your breath every day. So you got to make adjustments for that. So what does water prevent? Obviously, it's going to prevent you getting kidney stones and urinary tract infections, because it's going to flush. It's going to flush your system in a way that bacteria don't have time to stick. The stones don't have time to develop because there is a continuous flow of water. It's like a plumbing pipe in your house. If you lock your house and go on vacation for 6 months, when you come back, there's going to be a lot of debris in your pipe, and the water flow is going to be flooded. The only way you can maintain your pipes is, you got to keep the water flowing. The same way for the urinary tract. If you want to prevent infection, you want to prevent buildup of stones, you got to keep it flush by keeping yourself well hydrated. So now, what kind of beverage should I drink so that I don't get kidney disease? So again, they did a study. So this study was adjusted for energy intake, age, man or woman, education, BMI, smoking, physical activity. So they used a lot of parameters to see if intake of a beverage could damage the kidney. So sodas and sweetened fruit drinks with water. Okay, so these are the things was associated with a higher risk of chronic kidney disease. So obviously, if you're going to have sodas and sweetened drinks in addition to water, you will get kidney disease and your kidneys will fail. So this is what is there in the market. This is all the concentrates and juices. But at the end of the day, what our grandmothers taught us and what most of the world still does, that you only need to drink water. How much? If you're a man, 2.5 liters. If you're a woman, 1.5 to 2 liters. Simple. Next, let's talk a little bit about salt and sodium intake. Very important topic. Lot of discussions, lot of controversies. So the question we answer is, how much salt do I need and how much can I eat to prevent disease? Okay, so this is another thing what I get a lot. No, I don't use regular salt. I use rock salt or I use sea salt. So basically, the sodium content in your table salt versus rock salt versus sea salt is exactly the same. There is no good salt. Okay? So if you are eating American fast food outside, you on an average would consume about 18 grams of salt a day. 18 grams is what is there in fast food eating outside. But even for American adults who are not eating outside, they eat more than 3.5 grams of salt every day. What is recommended is you need to eat between 1.5 to 2.3. Try not to go below 1.5 and try not to go more than 2.3. So how much? So let's make an average. It's about 2 grams a day. So okay, you're telling me 2 grams a day. I'm not going to measure. How will I measure 2 grams? I don't have a weighing scale which can measure 2 grams. So it comes to exactly quarter teaspoon of salt throughout the day. So if you're a family of 4 people, you can use only 1 teaspoon of salt for all your cooking needs for the whole day. Very simple. Okay. How much, according to science, how much do we actually need to survive and not die from low sodium? You need 180 milligrams. So you're already eating 10 times more than what you need. You're eating more than 10 times what you need, and you're still saying it's not enough. So the American fast food in which you eat 18 grams, it comes to 100 times of what you need every day. 180 multiplied by 100 would make it 18 grams. So that is the amount of excess sodium we take. And excess sodium equals more water retention, equals swelling of the hands and feet, equals high blood pressure, increased heart attack, increased stroke, and on an average decrease in lifespan, which is scientifically proven by about 8 to 10 years. And this sodium restriction is not to be started at an adult age. It should also start being applied to your children in the house. So if they're used to a low sodium in their diet, then when they grow up, they will not. If they eat even little bit salty food, they'll say, "This is too salty," because you've already developed their taste to low sodium when you start off. So here it is. This is foods loaded with salt. You can see most of them are fast foods, processed, pre-prepared. So average, this much is consumed, but we should cut back to this much. You get high blood pressure, you get, water retention, puffy face. So how do you control your salt addiction? You have to read the nutrition label. If it is more than 5% of your daily requirement, it is not a low sodium. So read your nutrition label for sodium, you choose wisely, and you can always do portion control. If you want to eat outside, let's say you're eating in Chipotle, you can eat 50 to 60% of your meal. That way you eat less salt, less calories, less sugar, less everything. Or maybe share a meal with somebody at home. Okay. So this is what I had done so far. I hope it's enough.
That is wonderful information there. As always, there are questions, and people were kind enough to type them in. And of course, you will have opportunity. Please unmute yourself. I'll ask question that's here. My recent blood test report showed creatinine of 0.68, while therapeutic range is 0.7. So slightly low creatinine. What that means? Same question extends. The BUN, the urea level, is also lower, 3.5. The therapeutic range is 4.0. Would you like to answer that? So
Yes.
slightly lower value. So
Yeah. So the creatinine is okay. The creatinine is a reflection of the muscle mass. So if you have a little lower creatinine, maybe your muscle mass is on the lower side. Maybe this person is elderly, number one, or has consumed too many fluids before the test. So a lower creatinine is not as dangerous or as bad as a higher creatinine.
his hemoglobin level is also slightly low at a value of 13, as opposed to lower end is 13.2.
The low hemoglobin is not because of any kidney problem. There are many other reasons for the anemia which they should get worked up for. Especially make sure that you receive age-appropriate screening for colonoscopy and those things.
The next question here is that how many liters of water one should drink in the whole day? You addressed it, but some people go in and out. So if you would like to kindly address it again, please.
So for men, I would say at least 2.5 liters of water plus all the other beverages. You may have 2 cups of coffee a day. You may drink some buttermilk with your dinner. So the total fluid intake should be about 3 to 3.3, out of which water should be at least 2.5 for men. For women, 1.5 to 2 liters. I would say get closer to 2 liters, because that way, now we are living in the valley. Next week onwards, it's going to be 80, 85 degrees. You're going to have a lot of losses in your sweat. So I would say for women, at least 2 liters a day.
Thank you. I'll paraphrase the next question. So, if somebody is on painkillers, should they increase their water intake?
You should keep yourself well hydrated anyway, with or without painkillers. But when you are on painkillers, you have to be more aware and make sure that you are not dehydrated. So I would say that you should need to go to the bathroom when you're awake at least every 2 hours to make sure that you're drinking enough fluid.
Thank you. Dr. Nanavati, your question, please, sir.
Thank you. Dr. Raval, very enjoyable speech, great presentation. Thank you. I have a quick two-part question. Number one, do you recommend people with diabetes, which is under good control, to take something like lisinopril as a primary prophylaxis? And part two question is, I'm an orthopedic surgeon, and sometimes it is hard to manage arthritis of the knee when people don't want surgery. They are afraid of cortisone injection. Medications like Celebrex are not covered by their insurance. Tylenol doesn't work. So we end up telling them to take something over the counter like ibuprofen or Aleve. And the question is, if they are nephrotoxic medications, is it appropriate to tell them, like what I say, that, hey, if you are in a lot of pain, take some Aleve, only once or twice a day if necessary. And then after a few days, take a drug holiday. Don't take medication for 2 or 3 days. And when the pain again becomes unbearable, to start taking Aleve again, because quite often it becomes an issue of quality of life. So do you have any advice, sir, on those two questions?
So the first question, yes, every diabetic should be on ACE inhibitor or ARB. Yes, it is known to cause decrease in proteinuria, decrease the glomerular filtration rate, and thereby be protective to the kidneys. At the same time, known to cause left ventricular remodeling. So ACE inhibitors are almost the same as angiotensin receptor blockers in their efficacy in diabetes. Every diabetic should be on that drug, on either one of them. Now, the way to prescribe would be what we were taught historically, like thyroid. You start low and you go slow to increase it. Because sometimes I see in the clinic, people start on, oh, you're diabetic, let me give you lisinopril 40 milligrams twice a day. Not required. That can cause hyperkalemia, acute kidney injury. So what I would do is I start them on about 5 milligrams once a day. Follow them back in about 6 weeks with a repeat potassium and a repeat renal function. If the renal function is stable, potassium is normal, I'll increase it to 10 milligrams per day. If there is a 30% increase, and this is also for board review, if there is a 30% increase in serum creatinine because of the ACE inhibitor, then we have to stop it. We don't have a choice, because then the acute kidney injury puts the person at risk for hyperkalemia and hospitalization and cardiac events. So this I've seen more in elderly people who have a lot of vascular disease to begin with. They already have amputation, they have very poor arteries. So the ACE inhibitor or the ARB causes more drastic reduction in the glomerular filtration rate and increases the creatinine and worsens the hyperkalemia. So even a dose of 5 milligrams of lisinopril is going to be protective. You can take it. You can take it. Start low and go slow.
Right.
Now, coming to the second part for using anti-inflammatory with little pain relieving properties in patients with joints. Recently there was a lot of data come out on people with chronic low back pain and arthritis are benefiting more from physical therapy than NSAIDs. I'm sure you saw that. It was a very big study, like 60, 80,000 patients. they did physical therapy versus placebo and physical therapy with NSAID. And the placebo physical therapy did better than the NSAID.
Mm.
So yes, so what they can do is, and not only for arthritis, I would say if you have a toothache, for example, it's severe. You have the toothache, they say, okay, 2,800 milligrams every 6 hours as needed. So when you have a toothache, what else is going to happen? Your fluid intake is going to be decreased. You can't drink because your mouth is swollen and hurting. So you squeeze in the ibuprofen, so you're taking NSAID, you're not drinking enough fluid, recipe for disaster, you're going to have kidney failure.
Mm.
And for the arthritis, yes, from your side to protect yourself, you may tell them, okay, I'm going to give you a prescription for 20 tablets or 30 tablets at the most. So 1 week course, 1 week or maximum 10 days. Ibuprofen 400 to 600 milligrams twice a day for 10 days. Don't give more than that. If they want to buy over the counter, it's up to them. But meanwhile, they have to do, strengthening their muscles. They may have to agree to the cortisone shot. They may have to agree for joint replacement or, Celebrex. So I think that option for temporary pain relief should be given, but not for too long of a time.
Okay. Thank you.
Can't hear you, sir. Dr. Srivastava.
Hello, Deepak Bhai.
Yeah, yes. I'm sorry, I was on the mute. There is another question that's here from Mr. Jalota. I have two friends who have lost both kidneys and are on dialysis. What's the advice for them? Is there hope for them short of transplant?
So according to the data, there is dialysis has almost 60 to 70% mortality in 5 years. So if I'm going to work tomorrow in my clinic and I'm going to see my 50 patients, if I go back after 5 years, I may be only able to see 20 of them. The remaining 30 are not going to be alive. That is the data. But at the same time, we have the longest person I've seen on dialysis when I was training in New York was a lady who was on dialysis for more than 27 years. But that is a person who never misses a treatment, does the usual, takes all the medicines she's asked to take, follows the diet, is compliant to all treatments, and is basically not depressed. These are the main things, is compliance to the prescription, compliance to medications, and mental health. If these three things are maintained, then their lifespan will increase. If not, the average mortality in dialysis patients is about 60 to 70% at 5 years. That has not changed for the last 20 years.
My wife asked a question that is there effect of tea or coffee on the kidneys?
In moderation, no. So tea and coffee are mild diuretics. So if you're having up to 2 to 4 cups a day of tea or coffee, you're okay. But if every drink you're having, I have a patient who used to drink only iced tea, about 2.5 to 3 liters a day, and he started developing kidney stones because I think he was, so any extreme of fluid intake is not advised, but 2 cups of coffee a day, no problem. 2 to 4 cups of tea a day, no problem.
And regardless of what time of the day you drink it, first thing in the morning or later in the day?
Regardless of the time of day is okay. Moderation consumption, no side effects, no.
Okay. As others unmute themselves and ask their question or put it in the chat box, I'd like to read this compliment from Mr. Sahota. Can this talk with questions and answers put on YouTube for the benefit of masses? I will like to hear it again anyway, not for me alone, but also for the senior community who are suffering and don't have anybody around to educate them on such matters. Yes, indeed, this is being recorded, including the question answers, and will be edited and then will be uploaded and published on YouTube. Yes.
Dr. Raval, my name is Makkan Gupta. I have a question. In the US, since my wife has been a dialysis nurse, so I kind of see in US people having a dialysis done 3 times a week. Compared to that, in India, people only do once a week or even less. Is that a financial availability or requirement by the country? Thank you.
So just a little perspective on how our kidneys work. So, as we saw, our kidneys filter about 150 liters of blood a day to produce 2 liters of urine. So our kidneys are working 24 hours a day, 7 days a week. Now, dialysis is usually given to people whose kidney function is about 15% or less. Let's say 10%. So the kidneys are working only 10%, and that's why we put them on the dialysis machine to, to take over the remaining work. So the studies which were done, showed that if you do 3.5-hour sessions 3 times a week, that is about 10.5 hours of dialysis, it comes quite close to what your kidneys would do in normal life. So then they decided what is the best way to deliver this. It's not easy for a person to come to a dialysis center on Monday, Tuesday, then take Wednesday, Thursday off, come back on Friday, Saturday. So they did the alternate day regimen for 3.5 hours, and they found that it's coming quite close. The blood tests were coming quite close to what it would be if the person had his or her own kidneys. Now in India, I know that each treatment costs anywhere between 3 to 1,600 to 2,600 rupees per treatment. So if a person has to do dialysis 3 times a week, it's going to be around 8,000 rupees a week. Multiply that, so 32,000 rupees a month to undergo dialysis, according to what they do it in the United States. So the financial reimbursement is a big reason driving the decrease in frequency in India. And in many cases, this treatment is only for the machine and treatment, not for the drugs. If you need epogen, it's extra cost. If you need vitamin D, it's extra cost. So then what we used to do was we used to tell them, don't eat too much protein. Come on Monday and come on Thursday. So Monday and Thursday, 4-hour treatments, and we used to be able to get by. But if I have to write a prescription for someone, in writing, if I have to give someone what is the best treatment, I would say 3.5 hours, 3 times a week. If that person is of normal body mass. I have patients who I need to do 6-hour treatment because they have big muscle masses and they produce a lot of toxins. So the reason why they do this less treatment in India is mainly because of, unfortunately, it's mainly because of financial constraints.
Thank you. There is a question in our request to you, Dr. Raval, to kindly review it because some people joined late. Can you please highlight the major things that we can do for preventing the kidney disease, especially water, salt, and diet?
So water we went over. In case in the setting that you don't have any specific restrictions. If you have congestive heart failure, then you can't use this thing. That if you're a man, you need to drink about 3 liters of water or fluid a day, of which most of it should be water. And if you're a woman, you need at least 2 liters a day. Salt intake, I would say safely about 1.5 to 2 grams a day. Now 2 grams is a quarter teaspoon of salt. And other than that, follow the myplate.gov advice on what your diet should look like. So while we are on diet, we can talk a little bit about the different ones. One is the Mediterranean diet, right, in which people say you live the longest, which is basically whole grains, olives, dairy, low-fat dairy like yogurt and buttermilk and cheese, right? So the Mediterranean diet apparently makes people live long. And the new one coming out right now is the paleo diet, which is basically a high protein and a high fat diet with low carbohydrates, which, which to me is a little extreme. Okay, so um, if I were to say what would be the best diet, I would say this. You know, if you know your weight, try to have 1 gram per kilogram of your weight as protein every day. Okay, so that you're not having less protein. If you're a diabetic, then you have to eat a low carb diet, right, to control your sugar. If you're a non-diabetic, I would say you can do moderate. Follow the My Plate Gov. Try to use whole grains rather than processed food. At least 5 to 8 servings of fruits and vegetables a day, even if you're diabetic. Okay, and dairy should be low fat or fat free. And you know, and nowadays, a lot of insurances cover a dietitian's visit. So if you can, you know, it's not a bad idea to sit across the table with a dietitian and give them the list of the foods you like. We have a lot of dietitians from India locally, so they will relate to our food too, right? So if you want to sit down with them in half an hour, 45 minutes, they could actually change the way you're going to eat and feel just by consulting with them for 45 minutes. And a lot of insurances nowadays are covering dietary advice.
Thank you. So as we go through the one round of questions, if anybody has any questions, this will be your last opportunity to ask that question. Please unmute yourself and ask your question or type in the box. One question I have is that back in the days when there was something called public gym, and you would go there like the 24-hour fitness or something like that, In Shape, they are selling these high protein diets and high creatinine diets. What's the effect on the kidney, if you will kindly address, sir?
Yeah, so the high protein diet, it causes what they call glomerular hyperfiltration because the protein load is so much on the filtration mechanism of the kidney. When there is glomerular hyperfiltration, sometimes it can like punch holes into the basement membrane, causing you to have proteinuria, and there's going to be some swelling of the kidneys. So if you want to go on a real muscle building diet, I would say don't cross more than 1.5 grams of protein per kg per day. The ideal is between 0.8 to 1 gram, and nowadays with the plant-based proteins, the plant-based proteins are known to cause less glomerular injury and are better tolerated for the gastrointestinal tract. So that is the advice. Try not to cross 1.5 grams per kg per day. So if you're on an average a 70 kg person, then you should not have more than 200 grams of protein a day. I would say 1.5 times 7 would be, yeah, about 100 grams. Yeah. So you should have about maximum 100 grams of protein if you are a 70 kg adult.
Thank you so much.
And the creatinine is not recommended. It is used by professional bodybuilders for getting those ripped muscles and those cuts. I don't think anybody in our forum is that extreme. If they need, then maybe they can give me a call and we can talk about it.
Right. And Dr. Virtu Arora, on behalf of the ADS, has a compliment here. Excellent presentation and practical tips for prevention by Dr. Raval. Thank you. So we all appreciate that. There is another question that came in. Some senior patients are on several blood pressure and sugar control pills for years. Will the solid binder
in those pills
in those pills damage the kidneys?
No, it won't. Now, the thing is, blood pressure control of the last 15, 20 years has undergone a lot of change. First, they used to give 1 or 2 medicines, and if the blood pressure was high, they used to say, it's okay, your body is like that, your blood pressure is always high. Now, on an average, 3 to 4 medicines are required for blood pressure control because they work by different mechanisms. And most of these drugs are safe. Now, there may be occasional reports where the binder or the color they use can damage the kidneys. But so far, nothing has raised any alarm to us saying that this particular chemical, which was, other than the active drug, is causing a kidney problem. No studies or no specific reports on commonly used drugs.
Okay. Girja, would you like to unmute yourself and ask this question? Because I'm reading it as nowadays there is Beyond Meat, etc. Vegetarian choices of protein is that high in salt. So I think the question is if the vegetarian choice of protein is higher in salt or high in salt.
Yes, yes, Dr. Srivastava. That's my question because we do eat that quite a bit, but it's a processed food, so I don't know how safe it is given all the dietary concerns we have.
Yeah, so if you have the label close by, you can see. So if it is, they usually
On the Zoom, right at the back.
Oh,
so you can read out the sodium.
Okay, I didn't quite get the answer, Dr. Raval.
We're just asked to read out the label so that I can see how much sodium is there per serving. So that way we can know whether it's high in sodium or low in sodium.
Okay, give me a second, so I will get it and then I will show it to you. But just give me a second, I'll get a package.
Sure.
And meanwhile, another question came. Can you please repeat the maximum safe protein intake? That was, you said that 1.5 grams, I guess?
1 gram per kg per day if you want to maintain your current muscle mass. If you're doing heavy weightlifting and you want to build your muscle mass, then the maximum would be 1.5 grams per kg per day with adequate hydration.
Okay. And Girja is
and make sure the protein supplement you're taking doesn't have any anabolic steroids or hormones, because because bodybuilders who have injected themselves with anabolic steroids causes a very specific kidney condition which is irreversible, and people go on dialysis because of that.
Well, thank you so much for that question. Girja is back. Girja, please unmute yourself because we cannot hear you right now. Yes, please. Thank you.
Okay. It says, I wish he could just see the package. Let me just see if it comes.
Yeah, just read me just the sodium.
Read it. Just read
Okay, I will read it to you. It says sodium is 350 milligrams, about 18%.
That is not low, but it's not very high. You can have, as long as it's one serving you're having. If you have 2 servings, remember that would make it 700.
And I'm allowed only how many milligrams per day?
Per day 2000.
Oh, okay. So 2000. But when you said it is 1 teaspoon, that looks so little because we put De Danadan kind of salt. And when you said that, it just is like a...
The first thing you have to do in the house is that salt shaker, throw it away. Use something else, put something else, not salt.
Well, rock salt is better than the regular salt.
No, it's not. All the salt are bad.
He said all the salt is, there is no good salt.
That's what I thought, but I was hoping I heard it wrong.
Yes, there is that Himalayan sea salt, there is sea salt, all salt have sodium, so it's the same.
And low sodium that they tout in the supermarkets you get, are they really low sodium or I am getting one for the worst?
Yes, so the low sodium soup is got shelf life of only 3 or 4 months. The high sodium soup is shelf life is 3 years. That's why low sodium is costly.
Oh, when your health comes, I think cost should not be a criteria.
Yeah. And if you're eating canned stuff, if you rinse it out in the colander, you lose 40% of the salt.
No. How about Sendha Namak? Same thing.
Yeah.
Okay. We are still, as long as the questions are coming, I'll continue to record because these are very, very good questions and excellent answers. A lot of people will be benefited by this recording. So I'm very interested in continuing. There are a couple of things. One
more question.
Yes, just a second, Charles. The one educational comment from Mr. Jalota. Sodium chloride is used as a preservative and is essential in packaged foods. Reading labels is indeed very important. So that, and then there is a question from Pinky, and then Charles, you. Pinky Sidhu wants to know, how about dash salt substitute?
Very good, very good, very good, and very important. So basically, DAS
Bekar
is
bang gaya tha,
they replace the
nahi,
sodium with
koi ठीक नहीं
potassium.
हुआ.
So DAS is potassium chloride instead of sodium chloride. So it is better, but it should be used carefully in people with kidney disease because that would increase the potassium level.
That's correct. Charles, your question, sir?
Oh, okay. So let me put myself. Hello, my question very quickly was, how about fresh coconut juice? What effect can it have on?
Fresh coconut juice is good. Only thing is it is very rich in potassium and very rich in sugar.
Sugar.
So
Okay.
if you can tolerate both, it's very good. It's especially good for athletes with cramps, and if you have diarrhea and you're losing potassium, coconut water is very good.
Thank you. Thank you again.
So for the clarity, I would like to say we are talking about coconut water, not the coconut juice. You don't take
No. Fresh coconut.
fresh coconut, but you are talking about the water, right? The
Yes,
water which is inside the coconut. Okay, thank you. All right.
Thanks.
Next question. We are ready for the next question. Anyone else? Okay.
How do I
So
get the volume? How do I get the volume?
okay.
Volume.
So, ladies and gentlemen, this was just a
It's
remarkable
just low on
presentation.
their end.
I always judge the quality of the presentation by
Yeah,
the
it's just low
Q&A
on their
session.
end.
No. मैं कार्य करूँ तो नहीं.
Yeah, you can hear it, but it's just very low because on
No.
their end it's really.
Q&A session actually gives us a nice measure about the efficacy of the lecture, the presentation, how people have paid attention to the subject matter, and then they have come up with the curious questions. And of course, it's also indirectly would test because the speakers are never prepared for the Q&A session because you don't know what the question will be. So it also shows that how intelligent they are and how they are able to help. So gives us a great deal of confidence when you hear a good Q&A session. And I'm very, very proud to say that today was one of the best Q&A sessions that we had in some time. So I'd like to thank you again. I would again like to welcome and thank your parents, Mehul, for joining us today and spending their invaluable time with ADS and its audience. With that, I would like to stop the recording part of it, and the microphones will be on, line will be on, and this will be time for asking informal questions unrelated to the subject and little bit of socialization for a few minutes. Thank you.